Hey, good afternoon. On behalf of the Oklahoma Alliance for Healthy Families, I would want to thank you for joining us. My name is Jacqueline McDaniel, and I'm the Executive Director. When the Oklahoma Alliance for Healthy Families was founded 3 years ago, we set out our mission, which is simply to provide education around vaccinations. Over the last 3 years, we've partnered with dozens of organizations to bring science-based information to Oklahomans and to Oklahoma leaders. Back in the end of May, you may remember, we visited with Dr. Mary Clark, president of the Oklahoma State Medical Association right here, and she answered a lot of great questions from parents and family members about COVID-19 vaccine for adolescents 12 and up. If you did not have the opportunity to join us back then, you can watch that recording on our Facebook page under the videos tab. One question that has since come up, among many, has been, should children who need complex care or have serious medical conditions be vaccinated? As positive COVID cases continue to trend upward, children and young people with special health care needs may be at increased risk for more severe illness and complications. So we reached out to Dr. Darin Brannan with the Children's Center Rehabilitation Hospital to help us answer questions and address many concerns parents might have, and he graciously accepted. Dr. Brannan is a board certified pediatrician who has been actively involved in caring for children with complex medical needs in the community for many years. Dr. Brannan is a graduate of the University of Oklahoma College of Medicine and has completed his residency at the Children's Hospital at OU Medical Center. Additionally, Dr. Brannan holds a Master of Public Health and Epidemiology from the University of Oklahoma. In 2007, he moved from private practice to work full-time at the Children's Center Rehabilitation Hospital in Bethany, Oklahoma, where he is the Senior Director of Clinical Informatics. Dr. Brannan, thank you so much for joining us today. We are also joined by Ryan McLaughlin. Ryan is a mother of 5 children, 3 of whom have special needs. In 2007, Ryan and her husband, Michael, started OKC Hope Link, a nonprofit organization reaching out to families of children with rare, serious, and undiagnosed medical disorders. In 2012, McLaughlin's lost their eldest daughter, Ellie Kate, to a rare genetic condition, and since then have been advocates for those who cannot speak for themselves. Thank you so much, Ryan, for joining us today.
Absolutely.
Please remember, this is a judgment-free zone. Our goal here is to be able to provide accurate information and resources on COVID vaccine, and also encourage parents to talk to their healthcare provider so they can make best decisions for their children and their families. Thanks to everyone who submitted questions prior to today's event, and we will get to as many as we can. So feel free to post your questions in the comments as well. We encourage questions and open discussion. However, we do adhere to be nice, be respectful policy. Any comments that do not align with this policy may result in participants being banned. We are live today, but this Q&A will be posted right here on our Facebook page, so please feel free to share. So we recognize that families are being tasked with making a monumental decision and have many unanswered questions about safety of vaccine and what to expect. Ryan, can you share a little about your family and how you and Michael made the decision to get vaccinated?
Yes, it's a complicated decision, I think, for everybody. Of course, there's all sorts of information and rumors about around and about, but I think the best thing that parents can do, especially parents of kids that have special needs and are considered medically fragile, is to really dig in and to check out the real information, the real scientific information behind it all, and to also really talk to their doctors. I know that's what we've done with our family. So Mike and I, my husband and I, both have been vaccinated, and we plan to have our 17-year-old and our 13-year-old vaccinated as well. And those are our only 2 children that are eligible age-wise right now to be vaccinated. Our 17-year-old is considered typical. He's a normal child. I know we don't use that word in the special needs community, so he's a typical child. Our 13-year-old, he has PANDAS, which is pediatric autoimmune neurological disorder associated with strep. And he also has epilepsy. And so that was something I was really concerned about doing, was having him vaccinated. Would that set off seizures? Would that make things worse? And talking to our neurologists and other doctors, what I've learned, and Dr. Brannan will be much more educated in this and can explain further, I'm sure, but what I have understood is that the long-term effects for COVID, especially in children, really affect the brain and can cause swelling in the brain. And that mimics a lot of what PANDAS does and is. And so in order for us to really prevent that from further happening with our son, it's important for us to have him vaccinated. And so that's why we've decided to do that.
Thanks, Ryan, so much for sharing, and again, for being here today. I know there are many families like yours who can relate and probably have similar experiences. So really, again, thank you so much. So we've received a few questions for Dr. Brannan prior, so we'll jump right into those. Dr. Brannan, you're ready. So first thing, is there a difference in the various COVID vaccinations, or are they all the same in the end?
Yes, I would, while I do not have to indicate whether or not there are conflicts of interest, I have no conflicts of interest, but my interest is to provide the best care kids can get and that they deserve, whether typically developing or children with complex medical conditions. So I think what I'd like to do is just to show a image, okay, to kind of look at the different vaccines. Can you see this? Yes, okay. To look at the vaccines, I think it's important to understand the way vaccines are made. The first one, which you see on the left, is kind of the standard vaccines that we currently have and have had for the last 30, 40 decades. The one in the middle resembles what is currently being used for the Janssen or the J&J vaccine. So it uses part of a virus that is already out there, which is called adenovirus, but it is not able to cause disease. And then they attach part of the COVID-19 surface to it. And then the one on the far right is kind of a newer technology where you simply present the code of the genetic code for the virus. So this is just a real quick summary of the number of children testing positive between March of last year and December of last year. And you can see that it is not a small number of individuals. And we'll go into the significance of this in a little bit. That kind of alludes to the point that Ryan was making. So the viral vector is the Janssen J&J vaccine. Simply put, they have a part of adenovirus. They plug in a part of the spike protein for the COVID-19 virus. There's a vaccine that's made for that, and that this vaccine is administered. All immunizations or vaccines can cause local and systemic symptoms. The local symptoms are tenderness, warmth, redness, soreness in the arm. You may even have lymph node enlargement or tenderness. And then systemic symptoms such as fatigue, fever, headaches, nausea, vomiting, diarrhea even. So this is the mechanism of the Janssen J&J vaccine. This is just a kind of a text summary. The most important thing about this here is that the viral vector cannot cause infection with either the vector or the COVID-19 virus. This is the technology used for the Pfizer and the Moderna vaccine. So it's a messenger RNA. Basically, you extract this piece of RNA that codes for the spike protein. You then wrap it around something that is considered natural to the human. We'll see that in the ingredients list. And you create a vaccine that's administered, and you can have very similar symptoms, whether local or systemic, to the vaccine. So messenger RNA is just simply something that is not in the nucleus of the cell that tells the cell to make something that's necessary. And in this scenario, the messenger RNA is telling your cell how to make spike proteins so that you can make antibodies. And that's just what this says here. So the differences in the vaccines that are currently approved for use by the FDA are basically summarized here. So you have the age, you have how many doses are needed, how far apart are they, the technology that's used to develop the vaccine. And you'll notice there's a reaction column and then an efficacy column. The reaction is divided into local and systemic. So local simply means discomfort or symptoms at the injection site, whereas systemic is affecting the whole body. Now, if you recall, the systemic response is your own immune system responding to the presence of this vaccine and beginning that process of developing the immune response, which would then in turn protect you against the disease when you're exposed to it in the wild or under natural circumstances. So what I've done here is that you've got a first shot. So these are the percent of individuals that have a local reaction versus a systemic reaction with the first dose and the second dose for the Pfizer vaccine. So this basically means that there is a slight increase in local reactions and even a more increase in systemic reactions with the second dose of Pfizer vaccine. We see a much more significant increase in both local and systemic reactions for the Moderna vaccine. Now, when you look, and just jumping down to Janssen, there's only one column here because it's a single dose injection, but there are some discussions that they may be making a booster dose for this. The efficacy overall, and I think it's important to acknowledge that this is not for children with chronic disease specifically. This is everyone. So the overall efficacy of the Pfizer vaccine at preventing disease, hospitalization, death is 95%. And Moderna is 94%. Now you can see Janssen is lower than that, but it's still a respectable number. all three of those currently protect better than the current flu vaccine does. So even if Janssen is inferior to the Moderna and Pfizer, it is still superior to our current flu vaccine. Now, the last column, with health conditions, that simply is referring to individuals with chronic disease. So while we don't have data that's specific to children with complex medical conditions or medically fragile children, this is something that we can kind of look at that may give some clues. So overall, what this simply means is that individuals with chronic disease have lower efficacy post-vaccination. So some of those individuals with chronic disease don't have as good a response as those individuals who do not have underlying medical conditions.
Okay, so it sounds like certainly those of us who don't have underlying conditions, it's even more important for us to have the COVID vaccine, simply to protect those that aren't fully immune to it.
Correct.
Okay. So you talked a little bit about side effects. Are there side effects that are more concerning for those within this population that you work with?
Yes, basically they fit into two separate groups, and that is the underlying condition of the child, whether it be neurologic, gastrointestinal, cardiorespiratory, is that well managed or poorly managed? So what typically will happen is with COVID-19 infection, pretty much all organs can be affected. Your kidneys, the heart, lung, brain. And while we principally focus on, or have certainly talked about, the respiratory complications of COVID-19 infections, to Ryan's point, there is a acknowledged cerebral impact or brain impact of the disease itself. So a child who has an underlying seizure disorder that may be appropriately managed with medications may all of a sudden be unmanageable. That may either be due to inflammation within the brain, or it may simply be due to the fact that the gut is affected and are not absorbing their seizure medications. Alternatively, if there are certain things that the parent knows result in the child having more seizures, for instance, when my child gets sick, they have a fever and they have more seizures, then that certainly would be the case with COVID-19 infection, because generally speaking, their temperatures are higher and may last for many, many days, even much longer than we would typically see with flu.
Okay. So what, as you know, as parents are taking their kids, what should they watch for after their child receives maybe their first and their second?
Yes, the principal things, and here again, if we're talking typical versus child with complex medical conditions, a typically developing child, we would expect nothing other than what we would expect with any other vaccine that is currently being administered. With the child with complex medical conditions, it really has more to do with, does that vaccine result in a fever, particularly around the second dose? And if so, it's entirely possible that they may have breakthrough seizures. So there are some things that we recommend, while it's not recommended for typically developing kids, but children who do have a predisposition to fever-triggered seizures, that they be pre-medicated with a fever reducer such as Tylenol or ibuprofen. The idea there is that if you are managing the fever, you may in fact help manage breakthrough seizures. So when it comes to the vaccine in children with complex medical conditions, that seems to be the principal one. Now, the other group of kids would fit more in the metabolic, gastrointestinal area. So if these kids are the ones that end up with the vomiting and the diarrhea, while that is not very common, a child with a complex medical condition that has already issues of malabsorption and develops diarrhea, that may interfere with absorption of nutrients, electrolytes, and even the medications that they're on to manage their conditions.
So what about, so if a parent cannot, if their child cannot receive the COVID vaccine, will they need to wear masks during the fall?
Yes. So this is a, let's back up a bit, because the current recommendations are that if the household, all individuals within that household have been immunized, then there is no need for that household or other households that have been fully immunized to practice physical distancing or have to wear masks. So if a household, with the exception of one, have been immunized, that household need not be concerned about physical distancing or mask wearing within the home. However, the precautions for the unimmunized individual still remain, whether in another home or in the community. Now, there is a very interesting article that came out recently that is referenced in the materials that will be provided, that looked at the protection of unimmunized individuals within a household that had been immunized. So this question is quite appropriate for the study that was done. And they found that the patient or individual that is unimmunized, 40 to 50% of the time will be protected just by the fact that they have other family members in the home that have been immunized. So there is that secondary protection that we have really hoped for. And we're starting to see studies come out that are actually confirming that suspicion that these, in fact, are providing protection to the unimmunized individual within that household.
So can you talk about what your thoughts are as a doctor on the risk of getting the vaccine versus not getting the vaccine? I think you've addressed that a little bit.
Yes, I would say that when we look at the overall efficacy of the vaccine, so in that first table, while the risks of local and systemic symptoms are there, those are not any different than what we would see with any other vaccine that we currently give our children, whether complex medical or typically developing. Additionally, having lived in countries where we have seen deaths due to vaccine preventable conditions, I am generally of the opinion that we should take advantage of technology that provides protection from disease, disability, and death. So I am an unabashed proponent of the COVID vaccine. But to answer the question, I think that if you were to sit down and kind of add up the pros and the cons, you would quickly see that while the number of kids that are hospitalized for COVID-19 is small, given the larger proportion of population, there are some very clear reasons for that are physiologic and metabolic. Now, what we don't know is the new variants of the virus that are circulating and that will be circulating, in the next 6 to 12 months, whether or not those behave similarly in children. The suspicions have been that Delta variant is much more contagious and infectious in children. So it would suggest that there is a shifting away from what we had observed last year as it relates to children not being affected by COVID-19. And I think that's overgeneralization, and therefore we really have to look at if your child is infected and if your child does have a complex medical condition that is brain, lung, heart, or any other organ for that matter, for a fact that COVID vaccine or the COVID virus will cause a negative impact on that organ. That is to be expected because that is what we see currently in those children who are affected by COVID-19. We also know that children who have received the vaccine, children, and of course, we're really talking 12 and up, who have received the vaccine, the number of complications, side effects, risks are very low, certainly much, much lower than what we're currently seeing in the COVID-19 kids. So overall, the risk of infection has the potential to cause worsening in disease and maybe even death, while the vaccine itself does not appear to demonstrate the same. It does not seem to worsen disease or even cause death. And to the benefit of that one child in the home who cannot be immunized, there really would be no reason for all of the adults in the household to be immunized. So if you really do have an issue with immunizing your child with complex medical needs or who is medically fragile, that certainly wouldn't excuse the rest of the household from becoming immunized, which would impart further protection to your child.
So one question that came in is egg sensitivity. So is it true that a child with egg sensitivity should not receive the COVID vaccine?
That is not true. Let me, if I may, there is, let me share.
You should be able to share.
Can I share a screen again?
There you go.
Okay. This right here, you should see a table, basically lists all of the ingredients that are currently in the 3 emergency use authorized vaccines in the United States. The active ingredient just simply indicates exactly what is being used for generating the immune response, and the inactive ingredients are used for the purposes of helping to provide a balance in pH or acid-base balance to make it easier for the body to use. You'll notice there is no egg, there is no gelatin, latex, preservatives, and also there are no metals in the product. What is curious here, you'll notice cholesterol here for both the mRNA varieties. And that's what I kind of alluded to at the very beginning, something that is considered normal to the body. So these vaccines use cholesterol to help the messenger RNA be able to transit into the body so that they can then be used by the cell to produce that antibody response. So it is a natural substance that basically is being used to help facilitate the vaccine response.
So if another question, my daughter has spastic hemiplegia related to a ruptured AV, atriovenous malformation in the brain. She is not yet of vaccination age, so we haven't visited that topic, but the rest of the family has been vaccinated. What are your thoughts as we approach fall and winter?
Yeah, the thoughts principally have to do with the kind of going back to this notion. I'm just trying to find that question here. To this notion of having that herd immunity, and I know we hear that term thrown around quite a bit, but like I said, the really cool thing that we're seeing right now is that all household members immunized do provide 40 to 50% protection to that unimmunized individual. Really cool to know that. Two is that while it is clear that this child cannot get the vaccine, there are certainly going to be a number of other infections circulating in the community. Flu, right now, we certainly are seeing a significant spike in RSV. So while we're talking principally about COVID-19, when the child is out of the home, masks should be worn because the community has not yet reached that herd immunity. And the other issue too is that while we're concerned about COVID-19, there are going to be there's going to be an increased concern about flu come this fall winter season for a number of reasons that we may cover a little bit later.
So another question is, as a medically fragile mother in the medical field, after reading various studies, it looks like I have less to worry about the vaccine and more to worry about the effects of COVID. Is this true?
This is true. The vaccine technology we have today is, and I'll geek out, it is just uber cool. And I'll just say that the technology that is being used right now is the basis for what all immunologists have been looking for, which is the universal vaccine. And so the idea that the industry could turn around a vaccine as quickly as they did is really phenomenal. And to think of all of the lives saved due to the vaccine is I mean, there's just no way to express how cool that is. Now, when we do look at the new technology, looking at those ingredients, if you look at the vaccines that we made 30, 20 years ago, there was a lot more ingredients in those vaccines. There was a lot more preservatives and things that probably at the time needed to be there, but today we have the technology that doesn't require them to be there. And so what we look at right now are vaccines that actually have much less side effects, principally because there's a lot less unneeded ingredients in the vaccine.
Good point. So in what medically fragile case or cases would you not recommend a COVID vaccine? Knowing that everyone's situation is different.
Yeah. And I think that generally speaking, this question really needs to be deferred back to the child's pediatrician and specialists, because while there may be a specific condition for that child, it may not be the same condition for another child that would cause the vaccine to be contraindicated. Now, clearly, the only existing contraindication to vaccination it has to do with the having had an allergic reaction to any of the ingredients or to a prior dose of COVID-19 vaccine. Now, there is a kind of a clearinghouse of sorts that is sponsored by CDC, which is the Clinical Immunization Safety Assessment, COVID-Vax, COVID-VAX. The materials that I'll provide have the link to that. But basically, it is a site where the healthcare professionals can contact to engage them in getting information to help make that decision, to help provide guidance in very unique type situations. So if I was to say that there is a contraindication to COVID vaccine, it only comes down to the ingredients, whether or not you've had an allergic reaction to those ingredients previously. Otherwise, the disease is far more concerning than any potential side effects of the vaccine. But again, would default to the child's pediatrician and specialist to engage in discussion with the parent and maybe even pull in the COVID Vax project to help provide additional information that may help make that decision.
Sort of along those lines, one person asked, my child is allergic to penicillin and amoxicillin. Are there any ingredients in the vaccine considered incompatible with those allergies?
No, there are no antibiotics in the vaccine, certainly none of the antibiotics that humans generally take. So a individual who has an allergic reaction to amoxicillin or really any penicillin-like drug would not have an allergic reaction to the COVID vaccine. That would also go for individuals who have allergies to foods, have allergies to nuts or bees, or environmental allergies. Those aren't going to be factors in the decision of receiving the vaccine.
So should, a sort of mask question, should my child continue to wear a mask after being vaccinated? And should we ask our vaccinated friends and relatives to wear a mask?
Okay. And so, I think that's an excellent question. And the kind of going back to the notion that within the home, if everyone is fully immunized, everyone can be unmasked. That family unit is visiting some other family unit who also has been fully immunized. There is no need for physical distancing or mask wearing. However, if there is an individual that is coming around, or they're going to an individual's home where they're not fully immunized, then masks should be worn by the child with complex medical conditions, particularly if pulmonary in nature. But if in public areas where you're not in a closed environment, the general recommendation is that mask wearing is not required in fully immunized individuals. And I would certainly echo that, even for individuals who have trachs or who are ventilator dependent, because clearly their lungs are being bypassed in a way. So it's not their upper respiratory tract that's the concern. So one, if fully immunized, the household is fully immunized, they don't need to wear a mask unless they're in a closed environment where there are other or individuals who are not fully immunized. If you're in public areas that are not crowded, it would not be necessary to wear a mask. But if you are in an area that is crowded, or if you have a child that has higher risk of pulmonary complications, then a mask would be recommended.
So when do you expect, do you think the vaccine rollout would be expected for children?
Okay. Both Pfizer and Moderna are currently doing trials for children younger than 12, but it looks like Pfizer may submit their emergency use authorization to the FDA as early as September for the 2-year to 11-year-olds. So it looks like it's just around the corner.
One last question. Our pediatrician's office does not carry the vaccine, and I hesitate to take my child to a public setting. What is the best way for her to be vaccinated?
Yeah, I think there are a number of resources out there that you can go to, where you can actually put in your zip code, your address, can provide a list of vaccine resources. A couple of them, there's a vaccinate.oklahoma.gov. There's also the vaccines.gov /search. Both of these provide an exhaustive list of sites that can provide immunizations and will actually allow you to go to the site for scheduling. Now, the question behind the question is, I don't want to take my child to a large vaccination center. I don't want to have to stand in line. Understandable. A lot of the smaller non-chain pharmacies and some of the chain pharmacies do provide permit scheduling time for high-risk individuals, and I would definitely make sure that you ask about what times would be available for high-risk individuals. The other thing is that there are a number of clinics that can and do get the COVID vaccine. They're also going to be listed on the vaccinatoklahoma.gov website, but only as vaccine is available. So your CVS, Walgreens, your mom and pop pharmacies are more likely to have ready access. But then again, it's making sure that you're able to achieve vaccination without having to be in a large group of people or standing in line. So I would encourage you to reach out to those individual chains, pharmacies, to see if they do have high risk time slots. Generally, that's going to be first thing in the morning. That way you can get in, get out without too much delay.
Dr. Brannan, I had a question I know that a lot of parents have on their minds right now as we prepare to go back to school. I know most school districts haven't made public their mask mandates and things like that. But for our children that aren't of age to be vaccinated, when they go back to school, is that something we should demand or request in our IEPs for our children that are going back to school, for their therapists and people they interact with to have masks or be vaccinated? I don't know even if that's legal, but just for their safety, is that something, or is it another time where they need to be schooled at home?
Yeah, and I'll start off by saying that I believe that every child should be afforded the privilege of education and therapy, and that is a privilege and a right. So while we've had a lot of children that haven't had that opportunity, over the last year plus, I do think it is paramount that be a objective. So there's basically three components to this. One is acknowledging just that the child has the right to receive these services and education. Two, that while the individual school system, city, county, state may have different opinions with respect to requiring immunization of their staff or students. Ultimately, that is what is going to be required to be able to get ahead of the virus. Now, while that does not necessarily answer the question, I do feel that being able to pressure school boards, being able to pressure city, county officials is essential to be able to provide that safe educational environment for all children. Having a child with medical complexity is a requirement of that school to provide the resources without discrimination. And I use that D word cautiously, but I do think that too often we have a tendency to focus on the larger good and not necessarily good for all. So to your question of should we demand, I think that's your right as a tax-paying customer or as a taxpayer to be able to demand that those services are provided to your child, including not just educational, but therapy as well. Third, really goes back to the larger community, like beyond the school. And whether or not there are going to be groups, advocates, develop schools that are directed specifically to children with complex medical conditions or that are medically fragile, that do acknowledge the importance of immunization, vaccination, protection, and provide the educational and therapy environment for the child. So I suspect that there probably is going to be kind of a move towards one, acknowledging that there may be a need for a different environment for a good number of our kids, that maybe the cities, counties are not willing to provide within the school system. So, you know, I cautiously say you have the right to demand. Whether or not that will be heeded is an entirely different story. But the bigger issue is that it is all in the benefit or for the benefit of the child, and to provide equal rights to every child. I do feel that we need to provide a safe environment for education.
Thanks, Ryan, for that question, and Dr. Brannan for answering all of the questions. So we have come towards the end of our Q&A today. Thanks for everyone who joined and all the questions that came in. As a reminder, we are live today, but this Q&A will be posted right here on our Facebook page. So feel free to share. If you are still not quite sure if you should get the COVID-19 vaccine, as Dr. Brannan has mentioned multiple times this afternoon, I'd encourage you to have a conversation with your doctor about any concerns that they know you and your family best. If you have received the COVID-19 vaccine, thank you for doing your part to help end this pandemic and to keep those who cannot be vaccinated safe and healthy. I could not end this hour without a friendly reminder that as our kiddos are heading back to school, please schedule your appointment with your doctor or contact your local county health department to get your kids updated on their childhood vaccinations before they go back to school. You can also check out our friends at the Oklahoma Caring Foundation, as they are providing vaccines for kids as well. We are also posting some resources, the ones that Dr. Brannan had mentioned before, in our comments. So check those out. So if there's nothing else, thank you, everyone. Bye.
Bye-bye. Take care.